Don't let diabetes control your destiny.
How are you controlling me?
Discover the life-changing breakthrough that's shaking the foundations of diabetes treatment. Join us on a transformative journey
Let's go.
as we unveil the proven strategies to reverse type 2 diabetes. For many years,
How many more yards is it to go?
it was believed by health professionals that type 2 diabetes was not reversible.
What?
The idea was that the pancreas, responsible for producing insulin, was worn out and unable to generate enough insulin.
Okay.
Consequently, once diagnosed, the condition was expected to progressively worsen.
No way!
No way!
However, recent evidence challenges this belief. Recognizing the potential for reversal is significant because it suggests there are actionable measures to address the disease, offering hope and dispelling feelings of helplessness in diabetic patients. There are ways to reverse type 2 diabetes,
Really? In what ways?
In what ways?
What ways?
challenging the notion that it is a chronic and progressive condition.
Please be careful, please. Be careful.
It is commonly understood that weight loss can significantly improve or eliminate type 2 diabetes. While health professionals were taught that it was a chronic and progressive disease, the evidence showed that the key was helping with weight loss.
Fantastic. Well, that's good news.
Such good news. Well, that's good news.
However, the standard treatment for type 2 diabetes typically involves medications like insulin and sulfonylureas, along with low-fat diets.
Okay.
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 Despite using these drugs for 30 to 40 years, there is no evidence that they reverse the disease. In fact, it often worsens over time. The issue lies in the treatment's focus on using drugs for a dietary disease. While it was initially thought that type 2 diabetes couldn't be reversed, addressing the root cause by fixing the diet
I watch your diet, we follow the old regimen.
has proven to be effective in treating the condition.
Really?
Oh, really?
Really?
Recognizing the limitations of pharmaceutical interventions in addressing the root cause, a growing body of research supports the effectiveness of lifestyle changes, particularly dietary modifications, in reversing type 2 diabetes. Kindly show your support by clicking the like button, subscribing to the channel, and sharing your thoughts in the comment section. In 2020, the American Diabetes Association convened a meeting to discuss the most effective nutritional treatment for diabetes. According to their recommendations, reducing overall carbohydrate intake has shown the most evidence for improving blood sugar levels.
Is it carbohydrates or carbohydrates?
This indicates that the low carbohydrate diet is not merely a passing trend, but is supported by scientific evidence as acknowledged by experts from the American Diabetes Association. In practical terms, Doctors David and Jen Unwin shared results from their real-world practice in 2021 when they recommended a low-carbohydrate diet to their clients. Those who followed it experienced significant success, with 46% of individuals with type 2 diabetes reversing their condition solely through this dietary approach. For those with prediabetes, the remission rate was even higher, as 93% of patients transitioned from pre-diabetic to non-diabetic status by changing their diet. Interestingly, those with the highest blood sugar levels appeared to benefit the most from this dietary shift. Fasting has been utilized for over a century in treating type 2 diabetes. Dr. Elliot Jocelyn,
Who is that person, huh? Who's that guy?
Who is that?
A renowned diabetes doctor from Harvard Medical School discovered in 1916 that fasting was highly beneficial for diabetes treatment.
It's such good news.
Well, that's good news, right?
Yeah.
He published in a medical journal that brief periods of reduced food intake could aid diabetes treatment, a fact he believed was evident without requiring extensive proof. However, after the discovery of insulin, the focus shifted to using drugs instead of managing diabetes through diet. Dr. Jocelyn was not aware that there were two types of diabetes.
What type is that?
Oh, what type is that?
Type is that?
Type 1,
Type 1 diabetes. Do you understand? Yes, type 1 diabetes.
less affected by diet, and Type 2, where overweight individuals could benefit from fasting to achieve weight loss. Fasting has emerged as a powerful strategy for managing Type 2 diabetes, particularly through intermittent fasting methods like time-restricted eating and alternate day fasting. Studies indicate that intermittent fasting positively influences blood sugar control by enhancing insulin sensitivity. This process, leading to ketosis and the utilization of stored fat for energy, not only aids in weight loss but also reduces insulin resistance. Stay tuned for a revealing exploration into a groundbreaking solution for reversing type 2 diabetes, where swift changes through surgery may hold the key to transformative results. Stories shared in Reader's Digest also highlighted the efficacy of intermittent fasting in reversing type 2 diabetes. People described how abstaining from eating for a period led to decreased blood sugar levels, enabling them to discontinue medication as they lost weight, often resulting in the disappearance of diabetes. Bariatric surgery, also known as weight loss surgery, can rapidly reverse type 2 diabetes. In the early 1990s, researchers observed that procedures involving the removal of portions of the stomach and rewiring the intestines led to a swift reversal of type 2 diabetes.
Are you serious? Are you serious?
Are you serious?
The normalization of blood sugar levels occurred within weeks, even before significant weight loss. Individuals who underwent these surgeries often ceased taking diabetes medications, and the positive outcomes persisted over the long term. Gastric banding, a surgery where a band is placed around the stomach to restrict food intake, produced similar results in improving type 2 diabetes. However, studies comparing diet and bariatric surgery revealed that the diet alone induced substantial weight loss and even more significant improvements in blood sugar levels. This emphasized that success wasn't solely attributed to surgery, but also to dietary changes. Despite the effectiveness of surgery, it is invasive, costly, and associated with side effects. Recent evidence challenges the belief that type 2 diabetes is irreversible. This shift in understanding offers renewed hope and alternative solutions for managing type 2 diabetes. If you found this video to be valuable, kindly show your support by giving it a thumbs up, sharing your thoughts or questions in the comment section, and subscribing for more helpful content in the future. Wishing you the best on your journey to diabetes recovery.